She is a 39 years old patient with 2 previous abortions. In this ambulatory, we have the possibility to perform the one-step approach. So when we have a suspect of any intrauterine pathology or uterine malformation, we can perform an ultrasound, a 3D ultrasound, as in this case. You can see I have my volume, and I show you in this case we can optimize the image to perform our diagnosis. And look, we have this partial septum. This is the interosteal measurement. This is the depth of the septum, only 5 millimeters, but we have a myometrium of 1.4 centimeter. So in this case, we perform a diagnostic hysteroscopy, and then we can treat this little septum. So give me the hysteroscope. We use a new sheet, a H-shaped sheet, Olympus. The diameter, open the water, please. The diameter is 5.25 millimeters. So with vaginoscopic approach, we identify the external uterine orifice. So we enter slowly into the cervical canal, and we have to follow the mucus. We perform this procedure without anesthesia and analgesia, only using vocal local. Come sta, signora? So you can see the left and right ostium with this fundum, and I think there is also an isthmus a little bit smaller. So Valentina, give me the electrode. We can perform an incision, a longitudinal incision on the isthmic area, on the right and on the left wall. So we can perform this one-step approach. We performed an ultrasonographic diagnosis with this, in this moment, and then a diagnostic and operative procedure. We use a fine French bipolar electrode to Zizolfi. I think it's as a T-shaped uterus in this case, or an uterus according to the new classification of HS, the U1c, the third subclasses. So look, we can perform this incision, longitudinal incision, on the lateral wall for 4-5 millimeter deep. Come va, signora? I'm asking to the patient how is this procedure. She's awake. And after this treatment, I can show you the 3D ultrasound. Okay, we use a mechanical instrument now. Now I show you how we can use this mechanical instrument for the residual septum of septum. We can use also this mechanical instrument to refine the lateral wall. Now we can see the ostium also on this right wall. So you can see how bigger is now the cavity. We can cut a little bit here this fibrotic tissue. Okay, so look how bigger is the cavity now. So at the end of the procedure, we apply an anti-adhesive gel into the cavity. Look, this bubble, to prevent an adhesion. So in this our one-step approach, after the diagnostic and operative procedure, we can perform our post-surgical evaluation using ultrasound. We acquire our volume, and then we can optimize the image using this volume offline, so without the patient. And look, this is our result on the coronal plane with a quite normal uterine cavity.